Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers, producer of Public Health on Call. Today, an update on Ukraine. Len Rubenstein is a human rights expert and distinguished professor of the practice at the Johns Hopkins Bloomberg School of Public Health. Just back from a trip to Kyiv, he speaks with Dr. Josh Sharfstein about his meetings with health officials, what he learned about the attacks on health facilities, and his impressions of the situation today. A content warning that this episode contains depictions of violence and torture. Let's listen.
Len Rubenstein, thank you so much for joining me today, just back from your trip to Ukraine. Tell me about the trip.
The trip was organized by a humanitarian health organization, Med Global, which provides training and other forms of support for Ukrainian health professionals and the Ukrainian population. This was a somewhat unusual trip, though, for an aid group, because it was essentially a solidarity trip to express support and learn from Ukrainians about their needs and how people in the United States could be supportive. The group itself was quite eclectic. It was health professionals, humanitarians, human rights activists, and clergy from various religions. And because of the size and composition of the group and the fact that delegations like this have not come to Ukraine, we met with high-level officials, including deputy ministers of health and foreign affairs, deans of 2 universities, the Council of Churches and other religious organizations, parliamentarians, the Parliamentary Human Rights Commission, the head of the Kyiv Health Department, and others. I also met separately with the head of the War Crimes Unit in the Prosecutor General's Office, World Health Organization officials, a health think tank, among others. So it was a very illuminating and intense trip as well.
It absolutely sounds like that. I want to talk to you about the attacks on healthcare facilities and health workers. But first, I wonder if you could share your general impressions, fresh back from this incredibly impactful visit.
Kyiv looks like any other major European city. It's quite beautiful. People were going to work. Restaurants and cafes were busy. It looks like any normal city, not one at war. That is in part because it has the strongest air defense system in the country, thanks to U.S. Patriot missiles. Unlike the beginning of the war, medical students are going to labs. The systems are functioning. The local health director reported that services have even expanded. We visited a nice maternity hospital. It's no longer regularly operating underground or in the basement. But that normalcy, which is even in the safest city in the country, is really just on the surface. The air defense system is not 100% effective. One night when we were there was an alert sounded. We heard explosions from Russian missiles. And in that case, it actually destroyed a Pepsi-Cola plant and knocked out electricity in parts of the city. We also learned that the maternity hospital I just mentioned moves all patients to the basement when there's an alert, and they are frequent. And there was actually much more beneath the surface. Grief from the losses people have suffered, and anxiety about the possibility of friends and family dying is pervasive. People talked about the stress of anticipating and responding to alerts and missile attacks, the frequency of interrupted sleep that affects everyone. At the same time, people were incredibly unified, committed to winning the war. Many people describe the war as existential, the preservation of Ukrainians as a people, and characterize it as democracy versus tyranny. And without exception, they urged more military support from the United States. And they're deeply concerned about that. The Deputy Minister of Foreign Affairs told us she's actually worried about what she referred to as an Afghan scenario.
What do you think she meant by that?
I think she meant that there was a possibility of withdrawal of Western support. She mentioned that European support seems to be waning a bit, and she's very concerned about what Congress will do about the request for more military aid.
In these conversations, what did you learn about attacks on healthcare facilities and health workers in Ukraine?
The number of attacks by Russia on healthcare in Ukraine is extraordinary. More than 1,000 have been documented, and people talked about that a lot because it has had such an impact throughout the country. The Ministry of Health has destroyed ambulances right in front of the entrance to its building with signs explaining, for example, that a Russian tank fired directly at it. So there's no doubt about the extent of the crimes committed by Russia against healthcare. Any attack on a healthcare institution or a health worker or an ambulance is prohibited by the Geneva Conventions, and they're war crimes.
Could you give more examples? What besides attacking ambulances, what else is happening in those 1,000 reports?
Well, more than 100 hospitals have been destroyed. Also, health workers have been suffered enormously from violence against them. And I met with Dr. Elena Uzvak, a physician who directs a primary healthcare center in Hamsamel, which is outside Kyiv, which was one of the first places Russia attacked in 2022. It's close to Bucha, where the horrific murders of civilians was widely reported. Troops came to her house, took her and her husband and son away. She was subjected with what we call mock executions, that is, actions that were communicating to her that she was going to be killed. For example, a bag was put over her head and she was basically asphyxiated for half a minute or more. She was forced to walk through a field of bodies, and she expected to be shot in the back at any moment. Her husband and son were taken away. Her husband returned a couple of months later in a prisoner exchange, but her son, who was not a soldier, has been imprisoned illegally in an unknown location for more than a year and a half. She continues to run the center, now that serves an additional 5,000 displaced people from other places in Ukraine, while living with the uncertainty of her son's fate. It was a very intense interview.
Yeah, I can imagine.
I can add one more thing.
Sure.
Military doctors and nurses and medics have suffered the most. Russia is imprisoning more than 500 military medics as though they were prisoners of war, even though the Geneva Convention states very explicitly that medics are not to be treated as prisoners of war.
So you mentioned the Geneva Convention, you mentioned war crimes earlier, and I know you have written a great book on this topic. From your perspective, what you're seeing is not just horrible. What you're hearing about is not just horrible, but it's also illegal.
Yes, it's very much illegal. And I met with the chief war crimes prosecutor of the Prosecutor General's office in Ukraine. They're investigating some of these cases and actually brought one case of a tank that fired directly into a hospital. But in that case, they knew the names of the perpetrators from documents in the tank they captured, but they were tried in absentia. We need to see more prosecutions, and the head of the war crimes unit was very open to bringing such cases, but he's overwhelmed. They've had 110,000 reports of war crimes in Ukraine, so prioritizing, investigating them is extremely complicated and difficult.
And remind me, what is the court or the venue that those cases could be brought to?
Those cases will be brought in Ukrainian courts. He's cooperating both with the International Criminal Court, which is based in The Hague, and is what it sounds like. It's an international court as opposed to his domestic justice system. He's also in touch with governments in Germany and elsewhere, which are willing to bring cases in their courts under a principle that says if a crime is serious enough, it can be brought anywhere in the world. They're trying to divvy up responsibility in this very complicated situation of huge numbers of cases, huge numbers of crimes.
I can imagine how hard it is to run a health system to keep a population healthy under this kind of devastation. What was your impression with how Ukraine and Ukrainians are doing?
For the health system, what was so remarkable is how well, despite what I've said, the health infrastructure is functioning. Unless a health facility was totally destroyed, it's repaired quickly, except in the regions where it's very close to the front or was subject to fighting in the area. The World Health Organization is also supplying modular primary care structures in vulnerable areas, hospital basements in the most volatile regions are being refurbished. And equally remarkable, a health reform that was initiated in 2017 to build a system based on universal care and focus on primary care is still moving forward. Even in occupied areas, except in the occupied areas, I should say, and to some extent in places close to the front lines, access to primary care and pharmaceuticals has improved during the course of the war, even though cost to patients is a big issue. The director of the health department in Kyiv told us there have been no maternal deaths in the city since the war began, and they're actually expanding services to both citizens of the city and the displaced people now living there. Still, when we talk about the health of the population, the war has had a tremendous impact. There's a shortage of medical equipment, especially from traumatic injuries. Actually, we brought tourniquets with us. There needs to be expertise in prosthesis and rehabilitation programs for severely injured veterans. And most of all, everyone talked about a mental health crisis in the country. Soldiers suffer the most because of the horrors of the war at the front. But the stresses of being under attack for a year and a half and the enormous numbers of casualty and the losses, the experience of being subject to atrocities or witnessing them, as I explained with Dr. Uzvak, have an enormous impact, anxiety, depression, PTSD. Mental health resources were very low before the war. There's a broad commitment to addressing the crisis, but most needs are largely unmet, and everybody recognizes there's a very long way to go.
One last question for you. What is the state of the health workforce with so many people directly harassed or even imprisoned, and the needs of the population growing? I wonder whether there is a challenge in this area too.
The health workforce situation is critical. In the beginning of the war, as we know, millions of people left Ukraine, and among them were health professionals. the director of the Kyiv Health Department, which I mentioned is doing such a good job, had staffing before the war of 80 staff, 80 people. It immediately dropped to 10. It's back up to 50 as people are returning, and some clinicians are returning as well, but the shortfall remains severe. And those who are left work long hours with high demands, and they're exhausted and also suffering from trauma. So that, combined with the general demographic problem in Ukraine, which was losing population before the war, and now has lost people because of the war, means that this country is facing tremendous challenges in staffing its healthcare.
Len, I really appreciate your sharing these observations so soon after your return. What is the overall sense you're left with from this trip you took to Ukraine?
I would say this situation is very serious, and the future absence of international support would be devastating. But the Ukrainian people are so unified, so committed, so dedicated to a functioning country and recovery from this war, as well as winning it, that I found sources of hope and optimism from that very unity and commitment.
Len Rubenstein, thank you so much for coming onto the podcast, talking about your trip and sharing your reflections on these intense challenges in the situation in Ukraine.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.